Well, there's been tremendous excitement here at the iwCLL meeting, and that's witnessed by the large number of attendees, 1,400 people, largest attendee of any iwCLL meeting. And it's clear that there's been sort of a revolution in the thinking of CLL and also the therapy of CLL. It's really been a long process where many studies have actually helped to decipher the biology of the disease. And so by taking therapies that can target the biology, we have therapies that are transformative and that they're actually replacing chemotherapy. So I think a big take-home message here is trying to further understand the biology to help us stratify patients with the advent of new therapies, and also to potentially develop new therapies that might help those patients who are not so fortunate to be able to respond to some of these newer therapies. So on the first day, we actually had quite a lot of studies relating to some of the molecular biology, the interactions of cells, and trying to define what defines a CLL and also the heterogeneity between patients. And it's clear that there are new tools that we can use to distinguish patients, as well as new tools to be able to define the amount of leukemia that may be present after therapy. And so the integration of this is allowing us to make better predictions as what patients would be best on what type of therapy and what the outcome is that's predicted at the end of therapy by measuring for minimal residual disease. And it's clear that these tools are going to allow us to better understand, the patients that are going to be able to maintain a long-term progression-free survival versus patients that might require either continuous or more additional therapy. Today we had quite a big discussion on a number of the cooperative group trials that have been discussed. Randomized studies allow you to test whether one therapy versus the other has more side effects or is greater in activity. And it's clear, study after study has shown that when you stack up some of the newer targeted therapies that target, say, BTK, and with the advent of the BCL2 inhibitors, such as venetoclax, that when you match that up with chemotherapy, that the newer targeted therapies come out to be superior, not only in their tolerance, but also in their progression-free survival that's afforded after therapy or with continuous therapy. So clearly, I think there's a tremendous amount of excitement as witnessed by all the people here at the meeting, and I expect the excitement to continue to grow as more and more patients will have answers to their therapeutic needs.